Good evening and welcome to Hatching for Health with your host, Jessica Hatch. This evening, we're going to have a one-on-one with Dr. Remy Nader. Now, Dr. Remy Nader is a neurosurgeon here in Houston, Texas, and we're going to talk all about Chiari malformation. This is something very new to me. To my knowledge, 1 in every 1,000 children are diagnosed with it, but it does sometimes not get diagnosed until the adult age. So we are going to bring him on right now. It's through our video call. So welcome, Dr. Nader, to the show.
Hi, Jessica. Thank you for having me here today on the show. It's always a pleasure.
This is exciting too. I know we bring you on quite often to talk to some of the families, but just being able to have, undivided attention of yours and to talk a little bit specific to something that is completely related to, the brain. So this was a topic of your choice. And I want you to kind of just start by telling the viewers exactly what Chiari malformation is.
Yes, so Chiari malformation is actually a pretty rare condition that occurs in about 1 in 1,000 children and adults, but we believe that it's actually underdiagnosed. So actually there are more people that have it than we know, because a lot of people have it without knowing that they actually have it.
Okay.
So
yeah. Symptoms then, I guess first, what exactly, is it? So I guess by looking at someone, it doesn't sound like it's something that you would identify. It's definitely going to be identified, but with an MRI, or what exactly allows them to see this?
Yes, so this isn't something that you necessarily will pick up just by looking at someone, whether it's a child or an adult. So you really need to get some imaging studies, like an MRI, for example, to be able to identify it. So let me explain it to you a little bit. And I brought with me here a brain model, so
okay.
I can show you on the brain, exactly what it is.
Oh, great.
Okay.
I'm a visual, so I like that. Visual person.
Yeah, so that actually helps to see. So just to kind of go over some basics here. So on top here, we have the brain cortex, the cerebral cortex with the main lobes of the brain. So you have your frontal lobe, your parietal lobe, your temporal, and your occipital lobes here. And then over in the back here, there are 2 small portions of brain called the cerebellum, which essentially means the small brain. So It's like in the back of your head, right over here, basically right above your neck. Okay. And just in front of the cerebellum, or the small brain, you have what's called the brainstem. So the brainstem is essentially this long structure here that connects your brain down to your spine and your spinal cord. Okay.
Okay.
So this is like, anatomy 101, if you will, of the brain. So what is the Chiari malformation? What does that mean? So essentially what it really means is that there's part of your brain, or more specifically your cerebellum, that actually comes down into your spinal canal. So you're actually born with, if you have a Chiari, you're born with a smaller skull, and the skull that you have does not contain your brain, or you're born with a bigger brain, one of the two basically. And so part of your brain is actually pouching out into your spinal canal. Okay. It's not a good thing. I mean, it's, like, hey, I have a bigger brain, I must be smarter, but really it's not that great.
Yeah, and it is something that is, they're born with it, I guess. They don't, get it from, the outside world. It's actually something that's being developed, as they're growing in the womb.
Yes, exactly. So you are typically born with it, or you have I would say like a smaller form of it, and then as your skull develops in the first 2 years of life, then it can develop and get a little bit worse sometimes.
Okay, so symptoms. So this, when I think about what's going on, it it sounds like someone would be getting like headaches or migraines. I mean, like there's additional pressure there. So what are some of the symptoms?
Yeah, so the symptoms vary widely. So there are a lot of different types of symptoms. So first of all, Chiaris are classified into different types. So the most common types are, as you may have guessed, there's type 1 and type 2.
Okay.
Okay. So type 1 is not as severe as type 2. Type 2 occurs or is diagnosed more commonly in children and infants because it has more severe symptoms and because it's much easier to pick up on. Type 1, typically the children will have it or the infants will have it, but they won't know that they have it until they become more grown, until they get into their adult years, and then it's diagnosed later on in life.
Really?
So
So this is, even though it starts as an infant, these diagnoses are not coming, they're not actually receiving these diagnoses until they're an adult. Is that what I'm hearing?
yes, absolutely.
Wow. So they're kind of living with what symptoms exactly, or is it really not, those symptoms don't really happen until they get into the adult years? Is that what you're saying?
So if we take type 2, which is the more severe form, these symptoms actually can be pretty bad, pretty severe. So things like trouble breathing and aspiration, having some respiratory distress, a weak cry, sleep apnea. So a lot of the vital functions, so you got to think about this. So you have that part of your brain that's outpouching down into your spinal canal, but it's also compressing the brainstem right here. So the brainstem is a vital portion of your nervous system that's essentially controlling your breathing, your swallowing, your sleep-wake cycles, and it also controls, or it's also a conduit for all the nerves that come from your extremities, from your arms and legs. So you can also have some trouble with your motor functions, with your balance, your coordination. So also all the nerves that go to your face come out from your brainstem. So you can have things like facial paralysis, ringing in the ears, facial weakness, a weak cry in a baby. So it can be pretty debilitating for infants and young children to have this condition, actually.
Yeah, it sounds like it, but yet it's interesting that these conditions or symptoms they're having are not necessarily going to get them the diagnosis that young. I mean, do they also find that they're able to diagnose children? I mean, because of being given enough information, or do they tend to kind of have a direction with what's happening, but they don't really, fully kind of put a stamp on it, like this is what's wrong? You get what I'm asking? It seems a little bit hard to gauge.
So, unfortunately, it depends on the symptoms, and it also depends on the level of suspicion that the pediatrician is going to have, So obviously, in a large academic center, for example, like we have here in Houston, Texas, these conditions will be picked up on pretty quickly, and we will get MRIs or scans pretty fast to be able to diagnose them.
Correct.
So yes, so naturally you will need some form of imaging study, like an MRI, for example, which is probably the gold standard, I would say, to diagnose this and to be able to pick up on it.
I see. And, so it does sound like there's a cure. Like this is a surgical direction that, once diagnosed, that there's an option to have surgery to correct this. Is that right?
Yes, absolutely. So there is a surgery that can help and sometimes can actually cure the symptoms, but a lot of times it will help significantly improve the symptoms so that the child can have a much better quality of life and be able to, reach their developmental milestones and grow up more like a normal kid.
This is a bit off topic, but I can see how it would help, others and myself. Just for an individual with their brain and the spinal cord, is there a certain age that I guess all of that stops developing. Of course, we're always learning, but as far as like the brain growing and the, the spinal cord development and all that, is there an age that's kind of like, okay, that's the stopping point,
So there's no real stopping point per se. I mean, we're always developing. I would say the most amount of development of your brain will occur during the first 2 years of your life. And if you think about it, it kind of makes sense, because when a baby is born, their head is pretty small, and it's also very soft. You have your soft spot when you push on it. A baby, I mean, you can dig your finger almost into their skull if you're pushing, which I don't recommend it, obviously, but
yeah, but it is very, very soft. Yeah.
Yeah, it is soft. So because you have to think that the bones of your skull are sort of molding themselves as your brain is growing. And then by the time you reach the age of 2, these bones are fused together, and now they don't move anymore. And your brain has developed to a much sort of larger brain that has more connections and has more sulci and gyri, those little fissures that we see in the brain. So, and then after that age, the brain continues to develop, but at a much slower pace, basically. So, I mean, these conditions, the earlier they're picked up on, the earlier we can identify them, the better it is obviously for future brain development.
Yeah, that's what I would assume, and just being right there against that spinal cord too, like you're saying, all the other things that can tie into like anything nerve related, that just, it seems like the sky's the limit as to what kind of problems could occur for them if they are able to diagnose this early on and have it surgically fixed. So what does that surgery look like? I mean, you're going in, I'm assuming laterally, or is it coming in through this, posterior?
Well, I mean, there are different ways to manage this. So I just want to point out a couple of other things here that tend to be associated with the Chiari malformation. So when we're talking about a type 2 Chiari, the more severe form, it's also referred to as Arnold Chiari, because there were 2 scientists, Arnold and Chiari, that developed the notions, if you will.
Okay.
So an Arnold Chiari malformation is a lot of times is going to be associated with abnormal fluid flow in the brain and in the spinal cord. So what's going to happen is that, again, going back to the model here, is that you're going to have buildup of fluid inside your brain that doesn't drain properly because the conduit of the fluid is pinched off here. Okay. So as that fluid builds up in your brain, you get what's called hydrocephalus. So I'm just going to try to open this brain apart here and show you what I'm talking about. So over here in the center of the brain, there's this big fluid cavity called the ventricle. Okay. So the ventricle basically contains your normal cerebrospinal fluid, and that fluid basically circulates inside your brain, down your spinal cord along, a normal channel here, and all the way into your back, basically. But it also circulates around your brain, and it essentially supplies some nutrients to your brain. So depending on what the more severe condition is, if it's the fluid buildup in your brain, or the pinching off of your brainstem, or sometimes you'll have fluid buildup in your spinal cord, there are different treatments available for each one of these conditions. Okay.
So kind of layers of how severe it is, can actually be identified to figure out the best treatment for you. It's not just, it's one treatment and that's it.
Yes, exactly. So it's not just one treatment fits all, is you have to tailor the treatment to the more severe condition. So sorry.
No, I'm thinking, so that MRI would actually show, okay, there's fluid, here, or it's being, pinched off here. Like it would kind of give you the clarity of, okay, this is going to be the correct way to treat this patient.
Yes, absolutely. So you would go by the MRI. and what the MRI shows you. So a lot of times we will start by treating the associated hydrocephalus before treating the Chiari, meaning that we'll start by draining the fluid from the brain, so the brain is not under pressure.
Oh, yes, that makes a lot
And
of
then
sense.
we'll treat the actual malformation in the back of the skull. Okay.
We have
So
to take us getting really, really deep and exciting. We're going to take a quick commercial break, but we'll come right back and continue to understand this other layer of what can be diagnosed different from Chiari. And we'll talk more with Dr. Nader when we return from this commercial break.
My primary doctor referred me to Dr. Nader because of neck pain. It was determined I had bone spurs on my neck. Surgery was performed successfully and I feel much better. I highly recommend Dr. Nader and his able staff.
I'm Dr. Remy Nader, a board-certified neurosurgeon. Let me fix your back or neck problem.
How would you like to see your commercial on the Hatching for Health episode each and every Tuesday evening? If that's you, please email me at info@hatchingforhealth.org and we can tell you about all the fabulous ways to see your commercial on our episodes. And don't forget, we're a 501c, so any contribution is 100% tax deductible. We look forward to hearing from you. Being diagnosed with a scary sounding disease can be frightening. Imagine what it's like for your child. There are over 7,000 rare diseases around the world affecting children. Join me, Jessica Hatch, along with leading experts to help break down medical lingo, explain why and what their little bodies are feeling. Real faces, real stories, and expert advice. And you can watch us on the biggest South Asian TV network in North America, NTV Houston. And we are back. We have been joined by Dr. Remy Nader. We've been talking about Chiari malformation, and now we're talking a little bit about hydrocephalus. And this is actually tied to the other when an MRI is done, and we're learning a little bit more. I'm not the expert, so let's get back to Dr. Nader. And so before we took that break, you were talking about, leading up to someone actually being diagnosed. There's a potential that they might have this other, I guess, disease that can be drained. So kind of take it from there and back with what we were discussing.
yes, so it's two different treatments for the hydrocephalus and the Chiari malformation. So the hydrocephalus is essentially the fluid buildup in your brain. And in order to treat fluid buildup, you have to drain it. So you have to essentially put what's called a shunt. So it's a tube that goes inside your skull that drains the fluid to the outside initially, but then you can also tunnel this tube under your skin and make it go all the way into your belly, into your abdomen. And usually there's a little one-way valve so that the fluid actually drains from the brain down to the abdomen and not the other way around.
So then it comes out the bladder? Is that
So
what
it gets absorbed basically. So it goes like inside your belly. Like it doesn't go in your bladder.
And it's not harmful, obviously. They wouldn't allow that.
No, not at all. I mean, it's natural water-based fluid that your brain is producing, and it just gets reabsorbed by your body just like any water or any fluid.
And so what causes someone to, so is the buildup of that caused because somebody, has our initial disease we were talking about?
So hydrocephalus has multiple causes.
Okay.
One of them is that Chiari malformation that we discussed earlier.
Okay.
Another cause could be, you could just be born with it. You can be born with a very large head that has fluid buildup. That's called congenital hydrocephalus. Or you can develop it later on, either in infancy, in childhood, or as an adult. It could also happen because you have a brain tumor that's blocking the same conduit of fluid.
Okay.
Or you can have it from a bleed.
So the best case scenario, if you have this fluid, is for it to be the repeat the name.
Hydrocephalus.
Yeah, because you can drain that and be fine, versus it leading to a tumor or leading to the these names are
Chiari.
mouthful. Yeah, is that
Chiari.
right? So you want it to be this kind of middle ground where it can be drained out, and be, not have to, worry about some severe, I guess, disease that could actually be more life-threatening.
So yes, so absolutely, Jessica, the hydrocephalus has to be treated because it is life-threatening. If you don't treat hydrocephalus, yes, it is very life-threatening. If you don't treat it, the pressure buildup in your brain can increase and increase to the point where essentially you start becoming really drowsy, and then you become unconscious and you drift into a coma.
Oh, God.
And then you can die from this if you don't drain it out.
Wow. So is it something that it's constantly having to be drained and it just builds up year after year, or is it a one-time, cure to have that drain out?
So ideally, yes, it is a one-time cure. You put the drain, you tunnel it under the skin, you put it in the belly, and you're done. And that's it. It just continuously drains as the fluid builds up, and you don't need to do anything else.
Okay. But now if this fluid is tied to a tumor, I mean, is that just something you're having to constantly check on if you do have this tube inserted, to make sure that it wasn't related to a tumor, or do you usually know at that point?
So whether it's related to a tumor or the Chiari malformation that we talked about earlier, you still have to address the main cause, which is the tumor or the Chiari. So if it's a tumor, then you have to go in and remove the tumor surgically, or treat it with radiation or chemotherapy if it's, depending on what type of tumor it is, if it responds to these treatments. And if it's a Chiari, if it's a Chiari, then you have to treat the Chiari. So treating the Chiari actually involves removing part of the skull and creating, so you remove part of the skull that's in the back of the head. That's called the occipital or suboccipital bone. And you create a pocket for the cerebellum, or the rest of the brain that's being basically squeezed in. So you put the little membrane on top of it that you sew it up around, so it creates a little pocket around that area.
Oh, okay. So you actually put that, you sew that in there?
Yes. So it kind of looks like a little patch, kind of like what you have on those, the fashion from back in the 80s with those jeans and the patches. So it kind of looks like that, but it's on the surface of the brain, if you will.
And that allows someone to go about their daily life and not have, whatever problems it might have led to?
So again, ideally, yes. Now, obviously the treatment is not 100%, but I would say it's about 70 to 80% effective in helping patients with these symptoms. Yes.
So all three of these end up leading to a surgical route, whether it be the Chiari, obviously, the tumor, and then the middle ground of the middle one where you're actually draining the fluid out.
The hydrocephalus.
They all are, something that, again, you're born, and this is just something that you get diagnosed, and you have to, move forward and figure out exactly the right treatment. I guess, is it very common that people don't realize this and it leads to death? I mean, do people tend to ignore, or these symptoms, so pronounced that they're definitely going to get diagnosed?
So yes, in the type 1 form of the disease, so Chiari type 1, it's typically asymptomatic when you're born. So you don't have any symptoms, and the symptoms won't develop until later on in life, like when you're an adolescent, and then get into early adulthood as well. And those symptoms can be very non-specific, like you could have headaches, nausea, you could have trouble with your vision, So people associate those symptoms a lot of times with migraines,
Mm-hmm.
you know. And you can also have some psychological symptoms, like people start behaving more erratically, they have more trouble concentrating, they can be diagnosed with ADHD. So unfortunately, sometimes it's just hard to pick up on, especially when it's milder. Now,
Yeah.
obviously, the milder forms are not life-threatening, like a Chiari type 1. You're not going to have this hydrocephalus that's going to kill you potentially.
Okay. So, I mean, what I'm leading to, it sounds like if you have, any kind of symptoms that surround what we've discussed, it would be good to, to basically make an appointment with either, a neurologist or, neurosurgeon is kind of like the next step, but definitely to get an MRI, just to look at what's going on, because you wouldn't want one of these situations to go by and misdiagnose it at all. So I'll definitely get some contacts from you as far as the pediatric neurologists go. And I know we have such a big medical center, so there's a lot of folks that can help out with these types of treatments. Of course, if it's adult, then you're a perfect solution. So thanks for this information. I think this is great. It is rare. It's not as rare as some of the children we've had on the show, but every bit of what we discussed is brand new news to me. So appreciate your time, and I hope that we can help somebody out there that tuned in today.
Well, thank you so much, Jessica. It's always a pleasure to be on the show and to be able to participate and inform people about these rare conditions.
Awesome. Have a great evening, and thank you all for tuning in to another episode of Hatching for Health, and we will see you next Tuesday at 7:30.